Hello and welcome to our COVID-19 update, where we'll be talking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister, and thank you for being with us here today.
Well, thank you once again for having me on this program.
Okay, Minister, let's jump right into it. We're about 10 months now into the pandemic, and I know that early in the year, mostly elderly people and people with pre-existing conditions were the ones severely hit by COVID-19. Is this still the case?
It is. As you know, as of today, we've recorded 156 deaths. And when we examine the mortality profile, we're seeing a lot of older people. The majority of the persons who have died are older, and of course, persons with comorbidities. So we have had, in our context, persons who are diabetics, persons with heart disease, persons with kidney disease, persons with other lung pathologies, persons whose immune system has been suppressed, meaning persons with HIV. And we have had a case with a person with TB. So you have a range of comorbidities, and what we have observed is that these persons are at a higher risk for the disease. And that is why in coming up with our vaccine allocation protocol, that we strongly believe that we should immunize older persons and of course persons with the comorbidities, because they are at an increased risk.
Okay. Minister, what would you say to these persons who are at higher risk?
Well, a couple of things. The first one is if you have an underlying condition, then you need to make sure that you're taking your medication and taking all the necessary things to control that condition. So for example, somebody who's diabetic, what they need to do is to make sure they have their medication, they're controlling their glucose, and they're normalizing that. If your diabetes is out of control, that compounds the problem. So we want everybody with these underlying conditions to make sure they take their meds or whatever they're using to ensure that their conditions are stabilized and controlled. That then at least minimizes the risk. But as we have seen, persons with comorbidities are at higher risk. And therefore, those persons, once they self-identify, they should be taking additional precautions. So all the preventative things that we've been talking about, they need to take them seriously. So wearing your mask when you're in public, avoid crowded places, avoid staying in indoor spaces too long that is crowded, again because of aerosol transmission. Sanitize your hands when you're out there in the public. So all these preventative measures, people need to take them. And if you can avoid going out in the public, then that's a measure that you can take as well, because you're self-isolating. So you don't have to be COVID positive to self-isolate. You can prevent infection by staying away from others. And that is most appropriate at this point in time, because, with this holiday season, everybody want to go do shopping. Those areas are crowded. You need to avoid that because you're at that higher risk for getting disease.
Minister, you mentioned social distancing, wearing your mask, washing your hands. Is there enough emphasis to be placed on people to eat healthy, to keep their immune system proper?
Well, that always helps to have a balanced meal, to ensure that you're getting the right vitamins and proteins and so forth. Part of our problem here in Guyana, and that's a topic for perhaps another day, is that in Guyana we have malnutrition. I know when we use the term malnutrition, which is bad nutrition, we generally associate that with undernourishment. But malnutrition also means that people are not eating appropriately. They're not eating correctly. And we have a problem with obesity in this country because people are eating the wrong types of foods. And we also have a challenge where a lot of people like fast foods, which has a high percentage of trans fats. And that also then leads to a number of other illnesses, such as the cardiovascular set of diseases. So we will need to probably do more sensitization on how people can eat, what they need to eat. We have an abundance of fresh fruits and vegetables, but for whatever reason, we don't eat that, and we tend to eat the things that are really offensive to our health. So we need to start getting people to think how to eat properly, healthily, because this would help to boost your immunity and to make sure that you live longer.
Okay, thank you for that, Minister. Now let's turn our attention to vaccines. The talk of vaccines has consumed the country. Can you describe the immunization program that will be rolled out in Guyana?
Well, we are expecting a vaccine, and as I said before, we have been working with COVAX. This is the global mechanism that is run by Gavi and WHO and CEPI. And we are part of that mechanism. So we have signed on to some of the terms of references that they have sent to us. And there are some other agreements that we'll have to sign later on. We are working on those. So we, through this mechanism, because what they're trying to do is to acquire for 100 and something countries 2 billion doses of vaccines. And they plan to get that next year and the year after. And once they acquire these doses of vaccines, then they make them available to countries. So we are expecting that sometime next year, we'll get the first tranche of vaccines, which would be at 3%, and we'll make that available to our frontline health workers. So at the initial stages, not everybody would be able to access the vaccine. It would only go to a limited set of persons, frontline workers. But subsequently, we'll get some more vaccines, which would account for another 17% or so. And that set of vaccines, we intend to give it to older persons and, of course, persons with comorbidities, because we deem them to be at higher risk. We'll have to continue working on trying to get more vaccines, because many of the experts believe that for us to exit the pandemic, we'll have to achieve something that is called herd immunity. And to get to herd immunity, some of the experts are projecting that about 80% of our population would need to be immunized. And therefore, we'll still have to get some more vaccines to be able to reach that level of immunization in our population.
Okay, Minister, now for those who don't know, can you break it down to explain what is a vaccine and what it does to protect people?
Well, vaccine is basically something that is used to stimulate the immune system. Every person, you have an immune system. That immune system defends you against viruses and bacteria, basically defends you against any antigen. So what a vaccine does is to trick the body into believing that you're under attack, and therefore the body then ramp up its defense, produces antibodies to fight off these diseases. So when the real disease comes, they already have antibodies there ready and prepared to fight off whatever infection. In such a way, the person is protected. So vaccines have had this protective effect and has been used for a long time to protect humanity against various diseases. And they have been very successful at doing this. So for example, among children in Guyana, we have been immunizing children for many years now, and we use 18 different types of antigens to immunize children, and that has prevented these children from getting any of these diseases. So vaccines are extremely effective at preventing disease. This one that we are talking about, the COVID-19 vaccine, there are various types. And again, with the two that has gotten emergency use authorization, their efficacy is quite high. So it ranges from 94.6% to 95%, the Moderna and the Pfizer vaccines, which is extremely high. And we expect that some of the others would be high as well. So these vaccines are going to have a very good protective effect, protect people against COVID-19 infections.
So can you give an insight on the safety of vaccines?
So when you're developing a vaccine would go through different stages of testing. So there are three different types of trials. So the first set is to ensure the first phase 1 trial is to check to see whether or not this vaccine is working, and you try to set dose. Phase 2 trial, we look at to see the kind of immune reaction that is being developed. And then a phase 3 trial where you use it in a larger set of people to see whether how this works and to get a more precise understanding of its safety profile. For the Pfizer vaccine and the Moderna one, it has gone through these 3 levels of trial, and they have been able to get the information from the different patients, and they have been able to see how this vaccine works. So for the Pfizer vaccine, I think they looked at 44,000 people in the phase 3 trial. For Moderna, it's probably 30-something thousand. So there are wide groups of people and various diversity, background, age groups, and things like that. And from that, you get an understanding of how effective these vaccines are. So when the vaccine is ready, and given this authorization to be used in the general population, it would have gone through different level of investigation, and it's really safe to be deployed. And that's why they go through these different trials. If during these trials, if there's an adverse event that is developed by anyone in the trial, they'll stop the process, they'll investigate it, and in some cases, if they believe that this is, going to be problematic, they stop it completely. We have not had that with the Pfizer and the Moderna vaccines, and therefore that is why these are proceeding.
A lot of people are concerned about the side effects of these vaccines. What is your advice to them, and how would the situation be handled when the vaccines reach Guyana?
Well, I'm not sure what side effect that they might be worried about, because like with any vaccine, these vaccines are given intramuscularly, and therefore when you get the jab, basically you might have a little irritation on the skin. Some people might have a little bit of fever. You might get a little bit of pain. Those are normal things with vaccination. After a day or so, they subside, and that's it. So there aren't much side effects that we have learned about, excepting in the UK with the rollout of the Pfizer vaccines. There were 2 persons who had severe allergy, and when they got the vaccine, they had some anaphylactic challenges. But these are 2 persons who are known that whenever they get vaccines, they react in this way. So it cannot be attributed directly to this particular vaccine. It has been something that has happened to them before. So outside of those 2 cases, so far we haven't really heard anything else about these vaccines. So while we have to be vigilant and look out for side effects or so forth, so far none of this has been, any detrimental thing has been observed.
So these vaccines would be continuously monitored for safety?
Yes, and part of the emergency use authorization that has been issued for the Pfizer vaccine, I think they'll continue to monitor them for safety for another 6 months or so. And then after that, we'll have a larger pool of safety data in which to use to explain to people more about the vaccines and its characteristics.
Okay, before we move on from vaccines, Minister, I have to ask, earlier you mentioned the rollout of several immunization programs in Guyana. Can you comment on the successes of these?
Yes, our immunization program for children has been a tremendous success. In a lot of cases, we have been able to immunize like 98%, 96% of our children, depending on the antigen that we are using. And I recall some years ago, Guyana actually received a prize for being one of the best countries with our immunization program. So we have done extremely well in terms of vaccination programs in children. Where we have less experience is vaccination program dealing with adults, because this COVID vaccine is going to be predominantly with adults because they're the ones who are at high risk, and therefore we need to target older people and those with comorbidities.
Okay. Now, Minister, before we wrap up, do you have any final comments or advice to people as we approach as Christmas draws closer?
Well, my advice has been the same. It sounds like a broken record by now. And that is, I really and I truly believe that we can prevent a spike of infections if we take precautions. And, you know, when we look at other countries around the globe, we are seeing the challenges that they're experiencing. Germany has just announced they're going into a lockdown. Parts of Europe, they're doing the same. So people are anticipating socialization during the holidays, and they're trying to prevent spikes from happening. We need to take lessons from these countries, and we can prevent that from happening here as well. And we can do so. We haven't gone to lockdowns, but what we are advising people is to avoid crowded areas. We are advising people to use masks. We are advising people to sanitize their hands. And if you don't have to go to those areas, whether it's these shops and so forth, avoid them, right? And once you do that, you will remain safe. If you, however, disobey these rules and you go out there and, you're putting yourself at risk for infection and possibly hospitalization. And we don't know who would finally end up in the ICU. So we can avoid all of that if we take the precautionary measures. And I can't overemphasize this. This is a very, very important thing for people to understand. I still see a lot of people who walk around the place without a mask. I still see people going into crowded areas without masks. That type of behavior is only going to make you sick. And even if you are lucky enough to be asymptomatic, you will be taking that infection home to persons within your home, and you'll make them sick. And if you have an older person at home, that person is going to be at increased risk. If you have a diabetic at home or a hypertensive person at home, you're putting them in jeopardy. So let's do the common sense thing. Let us take precaution, right? And once we do that, we'll be able to mitigate against the increase in cases that we're expecting around this time.
Okay, thank you so much for that, Minister. This has been our COVID-19 update. For more information, visit our website dpi.gov.gy or our social media platforms.